Hello, hello. My name is Luam, and this is my presentation on ALS. In this presentation, I'll also be talking about the impact of the Ice Bucket Challenge. So, to start out, what is ALS? ALS stands for amyotrophic lateral sclerosis. This is a rare progressive neurodegenerative disorder. Neurodegenerative disorders usually get worse over time and they don't have a cure. As in ALS. ALS does not have a cure, but there are many treatments. This is also known as the Lou Gehrig disease. So, continuing on about what ALS is, ALS affects the nerve cells in the brain called motor neurons and the spinal cord. So basically, when these motor neurons degenerate, they can no longer send signals to the brain, leading to the muscle becoming weak and eventually shrinking and wasting away. So these motor neurons are needed for voluntary muscle movement. So that's like a reaction instead of a reflex. So yeah. And here are a list of symptoms of ALS. Here in this photo on the right side of the screen, a few symptoms of this would be like muscle weakness, muscle cramps, twitching, like having stiff muscles, speech challenges such as like slurring or like extreme stuttering, troubled swallowing, drooling, and then also like involuntary emotional expressions. So people with ALS, even when they have no reason to, they might start having emotional expressions such as crying or like hysterical laughter, but they don't really know why they are reacting the way that they are. They also experience fatigue. So all of these symptoms sadly do get worse over time. All of these affect the ability to walk, like doing simple tasks such as reaching for objects and chewing and speaking. So this can be life-threatening and extremely difficult to deal with. Many patients also have been diagnosed with anxiety and depression due to what they have experienced with ALS and how their body is shutting down. So some of the symptoms that I mentioned earlier, I just stated them again. They're sometimes it can get difficult and hard to breathe, stiff muscles, unintentional expressions like muscle twitching and drooling. And so there are two different types of ALS. The first one is a sporadic ALS. This is the most common type of ALS. As you can see to the left, there's a little bit of data that shows that 90 to 95% of ALS patients have sporadic ALS. The second type of ALS is familial ALS, which is very less common. Only 5 to 10% of ALS patients have this, and it's caused by inherited genes from one parent. So if one parent has this gene, then it gets sent down to the child, resulting in familial ALS, which is extremely less common. So to introduce, there was something called the 2014 Ice Bucket Challenge. This was created by Pete, Pat, and Anthony. These are 3 ALS patients who began the Ice Bucket Challenge. Overall, so basically to explain what the Ice Bucket Challenge is, so obviously there's a bucket of water and ice, and people all over the world would record themselves dumping that bucket of water over their head, and they would mention a little thing about ALS and say the reason why they're doing it. So they'll explain, I'm doing the Ice Bucket Challenge to advocate for ALS. Overall, 17 million individuals participated around the globe from over 150 countries. Below, I have three photos of each of the ALS patients who began the Ice Bucket Challenge. Um, as you can see, they're there. And a little bit more about this challenge. It was basically just something on social media, and it spread all across the globe, as I mentioned. Yeah, and overall, this allowed many people felt the need to donate a lot of funds to the ALS Association, which resulted in more research and more researchers being able to try and find a cure for ALS. So with ALS diagnosis, so these are the people who are more commonly at risk for ALS. Since it's more commonly for people who are adults and like older ages, so people around 55 to 77 years old. Race is also an important risk factor. The most common race to get this is white people, or like white individuals who are non-Hispanic. Also, for sex, it was more commonly seen in men than women. Also, being a veteran or being in the war before, since you're exposed to different types of things inside of the environment, it increases your chances of getting ALS. But this can't be confirmed. And before you go to a health provider who will diagnose you with this disorder. And in order to get diagnosed, there's a few tests that an individual would have to go through, which is blood and urine tests. They would also have to get an EMG or electromyogram. This is to test the muscle activity in the brain. And then they would also have to get a nerve conduction study. This nerve conduction study would be to test the nerve's ability to send signals. And lastly, they'd also have to get an MRI scan. So there are 4 stages of ALS from being diagnosed. ALS usually lasts, after diagnosis, the life expectancy is around 2 to 5 years. So throughout those 2 to 5 years, these are the stages that an individual or a patient would go through. The first stage is early. They would have difficulty with fine motor tasks. Some examples of this could be like writing or like buttoning clothes. Another thing that's seen inside of this stage is difficulty grouping objects. They also struggle with coordination issues and have a difficulty swallowing and chewing, because ALS not only affects the muscular systems and the nervous system, but it also affects the respiratory system. So during the second phase, or the second stage, an individual would experience paralysis and weakened muscles, not in all, but in a lot of their muscles throughout their body. They would also have a loss of muscle mass, and that would just intensify throughout the whole entire, through each of the stages, but it's more significant in the second stage than in the early stage. They experience a difficulty speaking and chewing, as like previously mentioned. And then they also drool because of an excessive amount of saliva inside of their mouth. The third stage of ALS is many patients would commonly experience not being able to eat or drink from their mouth, and their only form of nutrition would be like a feeding tube. Speaking is difficult or impossible. They won't really have the ability to speak because, like I said before, ALS is affecting the respiratory system, which includes the trachea and like the things that they need to be able to speak and get words out of their mouth. So there would be like different types of slurring and slowness in speaking in the difficult stage, but then it gets to the point where it's impossible and this patient won't be able to speak anymore. And then also the muscles in the chest are weakened. And due to low oxygen levels, poor breathing can contribute to the different symptoms that were previously mentioned, such as fatigue, fuzzy thinking, and like headaches. And in the last stage of ALS, paralysis of voluntary muscles, meaning that most of the muscles, majority of them, would be paralyzed. And there is an increase in respiratory issues, and this increase in respiratory issues is usually the main cause of death for ALS patients. The patient at the end of the day would be put inside of hospice care so they can get that care and the treatment that they need to continue living their life for the short period of time that they have left. As I previously mentioned, there is no cure for ALS. But there are many treatments that can manage the progression of ALS. The first one is riluzole. This manages the damage to the motor neurons, which are needed to control voluntary movement. The second medication that they would be able to take is Radicava. This would initially reduce the rate of decline in the muscles. So, as I said before, the muscle mass decreases, but this medication would be able to slow down the rate of the decrease. Another medication that they could take would be tofersen. This would decrease the damage to the neurons. Another form of treatment that they could do is go visit a physical therapist or an occupational therapist. This would help them increase their range of motion and be able to show them different things to do to be able to move more often and more properly. The life expectancy for ALS is around 2 to 5 years after the diagnosis, meaning that after 2 to 5 years of being diagnosed, they would pass away. So treatment reduces the toll that this disorder has on the muscular system, the nervous system, and the respiratory system, overall increasing the amount of days that this individual would have left. The research continues for a better life for those affected and diagnosed with ALS. In addition, the Ice Bucket Challenge that was done in 2014 gave them more funding for ALS. Just to add on to what I said in the last slide, the Ice Bucket Challenge had an extreme impact on the whole entire ALS community and all of those who have family members or care about this disorder. It overall spread awareness and brought more hope, more treatment options, and pushed for a cure. This was a global movement and motivated many individuals to donate millions of dollars for research to support ALS. And due to this, the patients can live a better life and know that they're supported and have a larger chance of finding a cure in the possible future. That's all. Thank you.